Hello, everyone. My name is Anastasia Romashkina. I hold a PhD in medical sciences and work as a dermatologist, cosmetologist, trichologist, and physiotherapist. The hand area is a highly relevant zone for women of all ages, yet it often does not receive the attention it deserves. What happens to the skin of the hands? It ages, loses firmness and elasticity, and wrinkles begin to appear. In order to address these issues, we will work with Collost gel products and correct these problems. When treating the hands, we pay special attention to the specific zone covered. It is important to remember that the hands are not limited solely by the palm or surface. We must also thoroughly treat the wrist joint. Therefore, hand correction extends up to this area. Here, we focus on the presence of horizontal wrinkles, which we will treat in greater detail, and then treat the entire surface of the hands using a dense micropapular injection technique. Many patients also complain of dryness and pronounced flaking in the interdigital spaces. If there is a history of such complaints, often corresponding to either atopic dermatitis or a history of eczema, it is necessary to also pay attention to the phalanges of the fingers and the interphalangeal spaces. For the procedure, we use Collost 15% gel that has been pre-warmed for 15 minutes. The 15% gel was chosen for correction as there are pronounced horizontal wrinkles that need to be addressed. In the wrinkle areas, we work with a papule by papule technique to create a linear effect. In this case, the patient demonstrates three horizontal wrinkles in the area of the wrist joint, and we treat each of them. After the procedure, a slight increase in the size of the papules is observed, which is a normal reaction to the injection of collagen products. We perform the technique using a dense micropapular injection method, making the papules very close to one another. When performing collagen stimulation procedures, regardless of the treated area, it is essential to prepare the region with 1 to 2 sessions of mesotherapy or biorevitalization. This is necessary to improve the intercellular space in the area where we will initiate collagen. On the patient's second hand, we similarly first treat the horizontal wrinkles in the wrist joint area, then move on to the hand area. In this case, the patient shows the presence of an old scar from a childhood injury. Questions often arise as to how old a scar can be treated and whether collagen therapy is effective for childhood injuries or scars that are over 20 years old. Yes, it is effective. In this case, I recommend that if you see scars within the treatment zone, you also work on them during all sessions when you administer the collagen product. We initiate scar treatment using a linear injection technique, performing injections directly underneath the scar. After the injections are completed, the scar should become raised. We treat the entire surface of the scar. There is also a small scar present. We apply the product in a linear fashion beneath the scar. The scar should stand out above the surrounding tissues. The patient's hand area has been corrected with extension to the wrist joint using the dense micropapular injection technique. The horizontal wrinkles in the wrist area have been treated separately with special emphasis on the atrophic scar on the patient's hand. At the end of the procedure, to reduce inflammation and promote faster epithelialization, we apply a post-procedural Collost spray that contains collagen, hyaluronic acid, and allantoin. This spray reduces discomfort after the injections and contributes to a quicker recovery.